Now, as a parliamentary committee that probed the Sputnik vaccine contract saga prepares to present its report, it's emerging the Health Ministry signed its second contract for the vaccines with an independent supplier 2 days after the Attorney General cautioned against such transactions. Godfrey Dami, in a 9-page letter to the Ministry of Health dated April 12, 2021, observed other countries are procuring the vaccines directly from Russia and urged the Health Ministry to do same and not use an agent. The Attorney General, in the letter cited by Joy News, wrote, "We suggest that the Republic of Ghana buys directly from the manufacturers instead of procuring through an individual in Dubai." The advice was in reference to an already signed agreement with businessman Sheikh Maktoum. But the ministry, however, on April 14, signed another independent contract, SL Global, for the supply of vaccines. Joseph Bukugakpo joins us with more. Now, Joseph, first tell us the latest on the Sputnik probe.
This is what we've gathered, that following the completion of the public hearing sometime late last week, the committee has retired to put together its report. We gather that sometime in the course of the day today, the leadership of Parliament actually met with the members of the committee for them to brief them on how far they'd gone with putting together their report. And the deadline that they have is this coming Friday, and from the indication that we're getting, it's highly likely that they will be able to complete the report and submit it on the floor of the House before Friday.
All right, you have a copy of the Attorney General's letter. What does it say?
A number of things. For example, it references what has come up earlier, where the minister admitted to that he sought no parliamentary approval for this particular contract, and that's something that the Attorney General advised the minister to rectify. Again, the Attorney General did offer advice that the necessary procurement processes should unfold, even though when it comes to the contract with Sheikh Maktoum, it had already been signed. But the Attorney General, in that particular contract, that particular letter, made the point that the Attorney General's office is suggesting that the Republic of Ghana buys directly from the manufacturers instead of procuring through an individual in Dubai. Our suggestion is premised on the fact that the vaccine being new, when there arises any issue in relation to side effects, the manufacturer is better placed to respond and to resolve the matters than an individual whom this procurement is being made from. But more importantly, the Attorney General made the observation that we also note that the vaccines are produced or manufactured from Russia, and other countries are procuring directly from the manufacturers. But Ghana has elected to procure it through a third party who is not an agent of the manufacturer, as such, making him not liable to Ghanaians and Ghana as a whole in the likely event of any adverse effects. So the AG made this specific observation, and this was on the 12th of April when this letter was actually sent to the Health Minister in reference to the contract with Sheikh Maktoum. But again, another document that we've seen have to do with the fact that with SL Global, a separate contract was actually signed, which will then allow for the procurement of more vaccines from SL Global separately, although the advice had gone that the Health Ministry should purchase the said vaccines from the manufacturers themselves.
All right, the AG also warned that government will not be able to deal with the suppliers for liability if something goes wrong with the vaccines. What was the point in the letter?
Let me quote that portion of the letter briefly. It says, our research indicates that it is the policy of the regulator, in this case the FDA, to register manufacturers and distributors of vaccines and require them to operate an office locally or within the territory, so that when withdrawals become necessary, the notices are issued directly to the manufacturers. But the AG went on to say that liabilities arising from a defect rest on the manufacturers and not the sellers. And in this case, in reference to this particular contract, the AG says the liability will be on the government in the absence of the seller in this agreement having a physical office in the territory, since it is the government that is procuring and giving the vaccines to the public. So the AG made that point there very forcefully, and this was actually the second time in the letter that the AG was making this particular point. And
then finally, the AG additionally raised issues with possible data protection breaches. And what do you have to tell us about that?
To quote that portion of the letter from the AG briefly, the AG makes the point that there are sections of the Data Protection Act which actually requires that when it comes to the processing of personal data, a person who processes any such data should ensure that it's being done without infringing on the privacy of the data subject. But the AG went on to say that the Health Ministry should go ahead and liaise with the Data Protection Commission to confirm whether or not sharing such data with third parties will not result in a breach of data protection as far as the rights of the people are concerned, since the Ministry of Health is dealing with the private office of Sheikh Al Maktoum. And so it essentially had to do with the health records of the individuals who would actually be getting some of these vaccines administered on, that the Attorney General was raising that possible concern of data breaches and made the point that dealing with an individual wouldn't be right.
All right. Thank you very much, Parliamentary Correspondent Joseph Boku Gakpo. You're watching Joy News Prime.